Hello, everybody. Welcome to 5 Tips to Improve Healthcare Communication. And thank you for all joining us today. Really happy to have all of you here and excited to run you through some of the things that we've learned as we've worked with healthcare organizations. As Scott mentioned, my name is Coleman Curry. Scott, you're far from the only person that's ever butchered that last name. We tried to, I think, at some point simplify it and just say Curry, but I appreciate the effort there. As Scott mentioned, I'm a strategic operations manager here with Lucid Press. I've been here for about 2 years. And in that time, I've worked with healthcare providers and healthcare organizations of all shapes and sizes. And our discussions have really been focused on how communication, both good and bad, can have a direct impact on patient experience and therefore impact your overall brand and brand perception and how that brand perception is growing in importance. In today's presentation, I'm going to share 5 tips that we've developed you can take and implement into your processes to start better understanding your patients and what they're looking for in communication. But before going too far, I want to make sure that I introduce my colleague, V. Lake, that will be assisting me today. She's going to be monitoring the Zoom chat and answering any questions that you have and following up on those questions. So feel free, starting now, if you have any questions, go ahead and start putting into the Zoom chat where you're from, what you do for your organization, and we can start the conversation there. And we're actually going to start this off with a poll as well. So what does your healthcare organization look like? Is it a doctor's clinic, hospital, urgent care facility, nursing home, assisted living facility, or other? And if it's other, please select other, and then great opportunity to put that into the chat, what sort of organization you're coming from. So I'll give about another 10 or 15 seconds there. All right. That's enough time there. Perfect. Looks like mostly hospital attendees, a couple others. Hopefully we have some good communication in that chat to see what some of those others are. All right, so let's get started. The first thing to talk about is the way your healthcare organization communicates matters to your brand. That may seem very intuitive, but brands are built up over every touch point that you have with these patients. And that good brand equity is much harder to build than bad. One bad experience can really taint your perception of a brand, and it takes a lot of those good minor positive steps to continue to build it up. So how do we ensure that out of every touch point that we have, that we're building that positive equity with patients and prospective patients? Whoops, went the wrong way there. And so what's in a brand? The reality is that it's a new world for many providers. Typically, healthcare providers haven't had to put much thought into their public image and outreach, but the healthcare industry of old is quickly evaporating and making way for a marketplace that looks much more like retail. And this presents an opportunity and a challenge. Providers that are going to concoct an appropriate branding strategy are poised to capture a much larger share of the market. It's easy to see that this is an era, not only in healthcare, but throughout all sectors, that's defined by consumerism and choice. Consumers are more informed than ever and are really expecting quality at every touch point, from communication to in-person touch points as well. So it's clear that the importance of branding is only growing in the healthcare space. And it's really important for leaders to be thinking, what ways are we differentiating our organization? How are we different than the other hospital or clinic that's down the road, and what makes us the choice to go to? Next is, how do you catch the eye of these consumers? It comes down to thinking outside the box. The brand is more than just a logo. It's it's creating an understanding of what your organization is all about to patients and internal stakeholders. Knowing what consumers or your patients want from you and ensuring that the brand permeates every facet of the experience, both for patients and those who work within the organization. So direct and immediate communication between patients and hospital staff is essential. The health of the patients can depend on a clear and concise exchange of information, letting them know what their treatment plan is, what the next steps are. All that information being clearly conveyed is really important. I think there's too many of us that have personal experiences or have heard about experiences where navigating a healthcare system can be unnecessarily frustrating due to a lack of communication or something that could be simply solved. And fortunately, I think from the consumer end, there's been a recent shift in the industry to a more patient-friendly approach. That could be due to things like emergence of online reviews, patient surveys that can help measure satisfaction and help inform what sort of changes need to be made, and in-house training for better communication within a hospital. And so how does content communications impact this patient experience? And it really comes down to clear and consistent communication. And how you can do that is by empowering your staff, enabling staff with the right tools to create a great patient experience, and educating staff on the ways to improve communication with patients. And from the patient communication, the research shows that high rates of patient satisfaction correlate directly with good patient outcomes. So bottom line there is that patient experience is really inextricable from the quality of care. And patient experience is a huge factor in your reputation as a healthcare provider, and it influences whether your organization is recommended and well reviewed, or on the other end, not recommended, not well reviewed by your patients. And if these patients have bad experiences or bad ways of communication with a physician, they can go on and leave a bad review online, and this could dissuade a lot of future potential patients from visiting your clinic. They could leave those reviews online. They could just share it with friends, or a chance that they just don't come back. Put another way, the patient experience has a real direct effect on your financial success. And in the highly competitive world of healthcare, each patient that comes through those doors really matters, and it matters more and more over time. And making them a repeat patient, they come back through your doors, they trust you, they share that they have a positive experience with those in their network, or the reviews that they're leaving online can all really affect your bottom line at the end of the day. So imagine this less than ideal patient experience scenario. You're in a hospital, you're waiting for test results while you lie on a hospital bed under a scratchy blanket. The doctor comes in, mispronounces my last name, like almost everybody, but he may mispronounce yours as well. Doesn't go into a lot of detail, looking down at a clipboard or a pad, or iPad the whole time, and doesn't really answer any questions. You're kind of left scared, uncomfortable, unsure of the quality of care you're getting, and really all you need is that clear communication so you can get some rest and start to feel a little bit better. But that level of comfort seems impossible. So now today's webinar can't really fix doctor's bedside manner, but we're going to address how the creation of content can be an aid to the experience that your patients are having, and how that can be an important part of communicating with them. Let's go ahead and hop into tip number one. Got the 5 tips. Tip number 1 is identify what your patients want. The challenge is that a lot of organizations are unsure what the patients find most important in their healthcare experience. So a commitment to utilizing patient feedback surveys to generate insight so you can define the pillars of your brand is a great fix. Gathered data can show you where your organization's weak and potentially give you insight into creative ways to increase patient satisfaction. Before I came to work at Lucid Press, I worked for a company that provided a survey platform, and my job was to identify weaknesses for organizations based on the data that they gathered from their customers, their patients. And seeing that data was always very eye-opening. It was really fun to look at, and often with some minor tweaks, some major headaches could be resolved. Other times there were larger problems that an organization may or may not be aware of, and this information can make it much easier to know where to begin helping by diagnosing what the root cause of these maybe larger problems is. It may seem overly daunting to start tackling some of these problems until you can really see, okay, what's the root cause? How do we start eating this elephant one bite at a time? So by getting that information from the patients, you can really start to understand them and what they're looking for. And in terms of content creation, you can see here that the patients, they get their content, they get some sort of information about their treatment plan, information about their doctor or the clinic. They provide feedback to the healthcare provider via survey, which can help inform what sort of creation of collateral you're doing, help iterate there, which then goes back to the patient. And one of these days, you're gonna have the absolute perfect piece of material to pass back to these patients. You don't have to do this anymore. You've solved healthcare. So that's the goal in the end. I'm assuming everyone's on mute and really laughed at that joke, but I couldn't hear anyone, but I'll assume there's lots of laughter. Tip number 2 is be consistent. Consistency is a huge part of a positive experience. It's a real challenge to maintain that brand consistency across all departments and maybe multiple locations. So that consistency is a huge part of this. And for a seamless patient experience, it's important to enable staff to be able to edit and customize content on their own. And personalized content can include things like treatment information on a mobile application, a follow-up email, personalized content on a website, the direct face-to-face communication between the doctor or nurse and the patient, flyers, brochures, anything that has patient information about their treatment can also be involved in that as well. And having a uniform look and feel, as well as uniform messaging, can do wonders for your brand. As you can see here, a very similar look can really help you stand out. One example of how this is valuable that comes to my mind is how one of our customers, a healthcare customer, creates a treatment plan that's first verbally communicated from the doctor to the patient. And then based on the patient's request, this information is reiterated either in a digital format via email or in some sort of printed material made available on a mobile application. So they're getting this information directly from the healthcare provider themselves, and then they're also having material that they can reference on the back end if they, for some reason, forget an aspect or want to review what's been told to them. And all this material has the same look and feel, which helps differentiate you as a brand and makes it much easier for them to find this amongst all the other clutter that they may have in their inbox or that they have at home. And tip number 3 is remove production roadblocks. Now, how do we do this? Well, first, identify what specific production roadblocks you're facing in your organization and work to solve them so that content creation time is shortened. So here are a couple of challenges that we most frequently see in some of the fixes that we've been able to help with. So one is maintaining brand compliance across the entire organization. And one great way is to create lockable templates with guardrails for branding. So editors or designers create the templates. They set some specific areas that can be edited, other areas that can't, and then everyone is now able to be a content creator. Challenge number 2 is content creators and medical staff are not aligned on content, and making it easy to collaborate on clinical content with key stakeholders. So searching for a platform that allows for internal collaboration and communication, document sharing and approval processes is really crucial. A lot of times, someone that's in charge of creating collateral they're not going to be an expert in healthcare. So letting those that have the correct domain knowledge make edits, whether it be through manual edits or some automation that makes that a lot easier, can help to get people doing what they do best. Doctors prescribing treatments and designers making these templates that look professional and keep the branding strong. With that being said, I'd love to hear from you. What are some of the challenges that you're facing? We've got one of our next poll questions here. What's the main issue you run into when creating materials? Is it mundane design requests, balancing time between strategic projects requests, lack of ability for other staff to be able to make edits to documents, not enough manpower? If you have other thoughts, another great experience to ping V in the chat. We'd love to hear your thoughts. So we'll give about another 10 or 15 seconds there. All right, should be good. Thank you. Looks like balancing time between strategic projects and requests and not enough manpower on the marketing creative teams. A lot of what we hear, that sounds very much in line with other conversations we've had. All right, tip number 4, creating a personalized patient experience. Often when a patient is leaving a hospital or clinic, they will say pretty much anything to get out the door. What the doctor's saying is kind of in one ear, out the other, they're ready to go. So treatment, follow-up visits, they can all be really clearly communicated from the doctor. But can also be very helpful to have a customized brochure an email, something that's restating the treatment plan when their follow-up visit is, also including doctor contact information or hospital clinic contact information, all that in one centralized location for these patients, so that an hour later, 2 days later, when they think, okay, what do I need to be doing now? They know right where to go and can have that information readily available. So the challenge is helping patients feel valued and understand that their health is your highest priority. And by connecting dots between the patient experience and content experience with consistent personalized communication for patients every step of the way. Some of these examples can include a little bit about what we've talked about, where patients' education brochures with information about their condition, customized treatment plans, doctor's contact information. There are some research studies. And this, as we present this idea to a lot of organizations, it seems very daunting. This is, it'd be great in a perfect world, but there's just no way that we can actually make that happen. But once we show that, with some assistance from some technologies, automating a lot of this and awareness from the staff that these tools are available, something like this can be put into practice with relative ease. And the net result of this is having patients coming and going, feeling like they have much more control over their own health outcomes. They're much more bought in. They have real understanding of what the plan is, and they can move forward with confidence. So we've seen some real positive outcomes. And a lot of organizations feel that templates are only available in Microsoft Word or PowerPoint. There's a couple of problems with this. One is designers hate the lack of flexibility and can never get them to really be visually appealing. This isn't a design software, so they're not designed to be really visually stimulating. Also, they're open to be completely overhauled. There's no real locking ability, so someone can really completely bastardize what you've created. Secondly, medical staff hates that they're clunky, often hard to find. If there's a new medical staff member, they may not even know that things like this exist. So they're not great, they're not really utilized. And then third, and most importantly, the patients, due to the design team and medical staff both not enjoying the available tools, if they do end up getting anything, it really leads to a pretty awful end product, which is bad for patient experience as well. And which leads to the next poll question: does your healthcare organization have branded templates for medical staff to customize presentations, letterhead, business cards, brochures? And if so, what tools is your organization using to create these templates? The second half of that question, if you are using a specific tool, another great time to share that in the Zoom chat with me. All right, and if we could go ahead and wrap that one up. Looks like there's yes or somewhat, but could be better is the pretty common response there. Awesome. All right, and tip number 5, templatize communication collateral. The challenge is you want to increase your brand equity, but there's going to be a bottleneck of content creators. They can't create everything for everyone, which we saw as one of the survey responses is the lack of headcount. And it fixes templatizing communication collateral so that you can empower doctors, nurses, or other medical staff to be able to create on-brand content quickly. When others within the organization are empowered to create this content via templates, it enables more people access that brand equity. And when I say brand equity, what that is value that you derive from consumer perception of your brand name for your particular service. So an example of a strong brand equity is Wegmans supermarket chain, which is a supermarket chain I'm not familiar with. I've never been there, but they have so much brand equity that when a new store opens, their brand reputation generates crowds so large that police have to come and direct traffic in and out for store openings. So they've really built somewhat of a cult following. An example of poor brand equity is Chipotle in about 2015 when they had an E. coli outbreak over there throughout their, I don't know, thousands of stores. I think there were a total of 55 incidents. So, with the number of people they're serving, that's not a crazy high number, but those handful, or I guess 10 or 20 handfuls of negative incidences led to them really having their brand equity eliminated. They had years of built up favorable brand equity. A lot of people that was their go-to restaurant or fast food restaurant, and had I don't think I've been back since 2015, just due to that perception. So how do you get started? And we'll go through these a little bit, but by doing your research, making both templates and assets available, lock down branded elements, and marketing this internally. So number one is doing your research to identify which templates to create and the styles and components that people need. Take a look back at the most requested items over the past few years. Get a survey out to team members, seeing what they would utilize, and it may involve getting a little bit more on the ground level, speaking with people and maybe opening their eyes and their minds to some of these different tools and ways that the automation can make this really possible. Next is making both templates and assets available so that people can customize and stay on brand. Making the templates available makes sense, but the assets part is a really big component of this, whether it be a logo, approved copy, approved images, making those all available to these end users or medical staff is key to a positive experience. And then for the end users, giving them a simplified version of the template library that you have. You can narrow it down by their department, their location, so that when they come in and try to find something, they're only seeing collateral that's relevant to them, only their department or their location. They're not having to filter through hundreds or thousands of different templates. And then locking down the important elements to ensure brand consistency and compliance. So locking down things like logos or images, specific legal statements that may need to be in there, and then leaving other areas that are partially locked so that they can make edits, but things like fonts or colors can all remain locked as well. And then marketing this internally throughout your organization. So in organizations where we've seen this be very successful, they don't just assume that people are going to find out about this and start using them. They advertise in break rooms, on office TVs. They're putting up with notifications. They're notifying people via email or Slack or other communication tools. And then they're sharing case studies with teams that have found this very valuable. They're letting them kind of be a microphone to the whole organization about this. And we're doing things like a monthly gift card drawing for teams and users that are being successful. And with that being said, you may want to know more about how to make this really work. We have a free workshop with one of my colleagues, Tyson Mickelson. He's worn many different hats at Lucid Press, from a designer to customer success and now in marketing. So he's offering a free workshop on the 15th of July, and the fee should be dropping a link to this bit.ly link where you can go and sign up for that. But it should be great about secret to herding cats and internal marketing for brand templates 101. So takeaways today are: identify what your patients want, be consistent, do your best to remove those production roadblocks, create personalized patient experiences, and templatize your content. And one more link that V should be dropping in there is a new ebook that we just released, how to take your healthcare marketing team from surviving to thriving, which will encompass some of the thoughts I have today, but expounds on that quite a bit as well. And before we hop into the Q&A, here's a link to lucidpress.com/healthcare, where you can go in and find some more information. And if you have any direct questions, feel free to email me directly, ccurry@lucidpress.com, whether it be questions about templating, Lucid Press. If you have any tips for me, we're about to have our second daughter. So if you have any tips about raising girls, or if you have any thoughts about if my second daughter is anything like my first, I'm probably going to be knee deep in Disney princess stuff for the next decade. So any tips on getting Disney princess songs out of your head would also be much appreciated.
Thank you, Coleman. Having a second kid is fairly life-changing.
Yeah.
It's that much tougher. So do we have any questions for anyone? I have boys, so I don't have anything good. They just fight. So questions. I know you guys have kind of been going through the chat the whole time and discussing on there, so I know it's a little different than how we normally do it. But for anyone that's new to join, use the Q&A at the bottom if you have any questions for Coleman. I thought he covered things very well, and again, I like the interactivity of the presentation, but I know that may have covered some of the Q&A that we have during the course of the event. I got one question for you. If Word and PowerPoint are not effective, what software would you recommend? Would it be best to work with a digital designer to develop templates?
Well, I may be somewhat biased in my response here, but A lot of the templating that we're speaking of is offered. That's what LucidPress is a company, a brand templating platform that can make this process much easier and much more user-friendly outside of tools like PowerPoint and Microsoft Word. We offer the things like locking functionality. A lot of automation can be included in that to automate doctor information, not patient information, but information about the doctor, location, hospital information. So that can all be automated and made very simple and easy. Thanks, Pamela.
Well, thank you guys. I really appreciate that.
Thank you.